Hello, everybody. How are you? This is Heather Butts with Health for Youth, and this is Module 1, Lesson 1 for the Health for Youth Lehrer Prize for Community Wellbeing Public Health Incubator. Our program goes this summer starting June 22nd, 2021. Hope to see you there. If you'd like more information, please contact me at heather.butts at healthforyouth.org. So, in this lesson, we will be talking about vaccine hesitancy and legal cases surrounding this. First, vaccine hesitancy, vulnerable populations, and medical mistrust. So, this is an article that will be made available to you entitled Towards a More Inclusive and Dynamic Understanding of Medical Mistrust Informed by Science. And it basically speaks to why there is so much medical mistrust, specifically in certain populations, what this leads to, and why it is so challenging to deal with. Vulnerable populations and the trust gap. So, this is an article from the Washington Post that looks at a study examining coronavirus vaccines facing trust gap in Black and Latino communities. And this is somewhat of an intractable problem and has been with us for a while. Coronavirus isn't the first time that we've seen this, but it is obviously one of the more problematic arenas, namely because in the quest for getting more people to get vaccinated, if people have this level of hesitancy and trust, then it can make it very, very challenging. Equitable vaccine rollout in California. So this is an interesting look at foster youth and the drive for equitable vaccines rolling out in California specifically, and how California has been able to do an equitable rollout of vaccines over the last several months. So, key points overview. Medical exploitation, distrust, one of the reasons that people have vaccine hesitancy in certain communities of color, unique challenges of COVID-19 vaccine acceptance, another. Vaccine availability. Is a vaccine available in my neighborhood? Do I have to go to a doctor's office? Can I get the vaccine in pharmacy, my job, my gym? Now, obviously, over the last few months, with the opening up of the vaccines, it's been much easier for people to get access to the vaccine. But there are still issues in terms of that access that can be very challenging and difficult for people. Cost, do I have to pay for the vaccine? Is there some sort of a fee? What is my copay? These are a concern to people and can stop them sometimes if they don't know the answers from moving forward. Convenience, can I get the vaccine after hours? So is there a drive-through? Do I have a car? Drive-through can be difficult if you don't have a car. Um, is there a long wait? Service quality, do I feel welcome? How well will I be treated? Is there an opportunity to ask some follow-up questions? Um, all right, so these are just some definitions that we'll go through, thinking about vaccine hesitancy, public health, and another module, we're actually going to go in depth into public health and what public health means. Healthcare. What is healthcare? Is healthcare right? Does everyone deserve access to healthcare? Does everyone deserve access to public healthcare? These are questions that we will also tackle. And these are definitely topics to think about, which we will cover in additional modules. Uh, Virus and COVID-19, how does it spread? Social distancing, vaccine quarantine isolation, outbreaks, epidemic, pandemic. So these are all definitions that we will get into today, but then also in additional modules. So, a successful virus. What makes for a successful virus? Uh, well, according to Adam Loring, a virologist at the University of Michigan, a successful virus is one that becomes better at being a virus. And this can be from an evolutionary standpoint, can be from an epidemiological standpoint, and we will define those terms in another module. But what you need to know right now is that evolutionary and epidemiological underpinnings of the virus can speak to a virus being better at doing what it does. And in the case of coronavirus and all viruses, um, if a virus is getting better at being a virus, it's getting better at being able to be transmitted to more people and having more of an influence on them. These are variants of note that we know about right now. Of course, we would have to add the Delta virus, and now the B.1.1.7 is the Alpha coronavirus, COVID-19 virus. But these are just variants of note, and obviously, as time goes on, um, the CDC identifies other variants of note. This is a really important case, Jacobson v. Massachusetts. Uh, it involves a man, shockingly named Jacobson, who lived in Cambridge, Massachusetts. He was a pastor, and he did not want to get the smallpox vaccine. So before we had coronavirus, we've had many contagious diseases, and smallpox is one of them. And so Jacobson did not want to get the smallpox vaccine. And so um, he, in July 17th, 1902, the Board of Health of Cambridge required vaccination of all inhabitants not successfully vaccinated since March 1st, 1897. When Jacobson refused to get vaccinated for smallpox, he was fined $5. The authority of the state to do this, and of Cambridge specifically to do this, is police power. Jacobson argued a liberty interest invasion, and the court in the Jacobson case stated that the liberty secured by the Constitution of the United States to every person within its jurisdiction does not import an absolute right in each person to be at all times and at all circumstances wholly free from restraint. And so essentially what this means is, yes, you have civil liberties. You have the right to be able to be free from bodily invasion. But where that line begins and ends can have a lot of uh, underpinnings in privacy rights and also police power. So these rights are not unfettered. Some people wish they were, but they're not. Police power, state and localities, power promoting the public welfare by restraining and regulating the use of liberty and property. States cannot exercise powers relinquished to the federal government and specified in the Constitution. Uh, this is probably decently self-evident, um, but this essentially speaks to the issue of federalism and uh, the difference between state rights and federal rights. And states cannot infringe on the rights of individuals to the extent those rights are protected by the Constitution. So again, there are certain enumerated rights in the Constitution. Um, Other rights flow to the states, and the state cannot infringe on rights that are enumerated. If people don't agree with compulsory isolation, what if anything can be the government do? Government can do that. Government can do a lot. Uh, the government can compel people to isolation or confinement, especially if you're dealing with a contagious disease, can be spread through casual contact, and the transmission of the disease can't readily be prevented voluntarily, or is not prevented voluntarily by the person, the patient. Um, this just goes into a little bit in terms of stressors that people are dealing with during the COVID era. Um, and this goes into a little bit of information regarding anxiety during COVID and what people are experiencing. And the percentages for anxiety during COVID are up about 4 to 5 fold from what they were a little bit over a year ago before COVID-19 began. So that is of concern and something that the mental health field and mental health professionals are working on to tackle. even as we speak. This is an interesting graph that looks at anxiety and depression by race, indicators of anxiety and depression based on frequency through March 2021. And as you can see, the numbers are in the high 20s% to low 30s% in terms of those numbers. This goes into frequency of anxiety and depression. You can see these numbers top out are in the high 30s% for people, which indicates that a good 1/3 of the population in the states at the higher end of the scale self-report that they are experiencing anxiety or depression and are experiencing it during the COVID era. This goes into information regarding depressive disorder for women and men during COVID, with percentages for women being slightly higher than for men. And when you correlate that, there could be a number of variables for why that is multifactorial. And this talks about women in the workplace for 2020 and the challenges, especially for women in the Black community and what they are facing, which in the COVID era is quite daunting. This is an interesting article that I will make available to you, COVID-19 and Women's Health, a low and middle income country perspective, looking at different socioeconomic situations as it relates to COVID. And this is a gender-based violence article looking at violence during COVID and the impact of that on people's ability to get what they need, and also some of the services that are or not available to them. Moms Are Not Okay, COVID-19 and Maternal Mental Health. Very important article that I will make available. And this goes into depression and anxiety in the COVID era for mothers. This is a very impactful article looking at vulnerable youth in the COVID-19 pandemic. And again, this will be made available to you. And it's important because it looks specifically at the underserved youth and what they are experiencing in the COVID era. And then this article talks about service and usage during COVID-19 pandemic among emerging adults recently experiencing homelessness, another vulnerable population. This is from the World Health Organization and looks at vaccine hesitancy and the vaccine hesitancy model from complacency, confidence, and convenience. And what does this mean exactly? So it breaks down the three bubbles and talks about what each of them mean. So confidence, trust in the safety and efficacy of vaccines, as well as trust in the healthcare workers, scientists, and politicians who help deliver, craft, and regulate them. What does that mean? It means, do you trust the people giving you the information? When people tell you X, Y, Z from a public health perspective, do you believe them? Convenience, factors like the availability, accessibility, and affordability of the vaccine. Can you get to the vaccine site? Is it accessible to you? Complacency, the perceived risk of a vaccine-preventable disease, the extent to which vaccine is perceived as necessary or worthwhile. This is a little tricky. Basically, it means that people actually think the vaccine is beneficial in order for them to be to believe that it's worth getting. So somebody might think, oh, the vaccine is perfectly fine. It's just not that helpful for me. I don't need it. Maybe that person needs it, but me, not so much. So that's complacency and can sometimes be confused with confidence, but it really concerns efficacy as opposed to safety. So some people are concerned around the vaccine's safety. Is it safe? Is something going to happen to me if I take it? Other people are concerned about, does it work? And does it work for me? Will it be helpful for me? So that's the difference. Complacency, convenience, confidence in action, Operation Warp Speed. Some people are a little uncomfortable with their vaccines being warp speed. they want slow speed, snail speed. So that can have an issue in terms of complacency, convenience, confidence, social determinant issues, precluding the ability to access vaccine. We talked about that a little bit already. Ability to get to and from vaccine site, fear the vaccine's happening too quickly. That again goes to sort of the warp speed. Now, placebo-controlled studies that will continue. How do we get, what are the pros and cons of that? And then how long will the immunity last? Unclear. Goals, problems, messaging. So this is really interesting. And this goes to how do we convey the issue regarding COVID-19 to others? And what does that look like? And that's a goals, problems, messaging issue. Are we talking about COVID-19 in terms of problems? Are we talking about it in terms of goals? Oftentimes goal messaging can have a longer lasting, deeper impact on people because people see it from the perspective of, oh, this is something that we're all trying to do together. There's a common goal and we're going for it. So there's that. National strategy for the United States is organized around 7 goals, including restoring trust in American people, mount a safe, effective, comprehensive vaccine campaign, safely reopening schools. We're seeing that now. Protecting those most at risk across racial, ethnic, and rural urban lines. So these are all goals. This is where we're headed with this. This gets into percentage of Americans worried about contracting COVID-19. This is along gender lines, very interesting. A lot of the mask mandates are now being lifted. When they were in effect, upwards of 90+% of people were wearing their masks. So that's impressive. This just goes into differences in mask wearing. And this is a really great quote from the United Nations Secretary General, where essentially it talks about we will come through this together. If we work together, we'll come through this together. And I would say that the messaging around that is, again, COVID goal-oriented, not blame-oriented. Therefore, they're to blame. They're the problem. Can be a lot more helpful in terms of coming through this together. Okay, I think that's a good note to end on. That is our next module, module 1, lesson 1. And we will be back for another module and lesson next week. Goodbye.